And on the program today, we take a look at the budget presentation of President Bola Tinubu on Wednesday, assuring Nigerians of better days ahead as economic reforms begin to yield positive results with noticeable signals in improved security, education, healthcare, and a globally acknowledged 3.4% GDP growth in the third quarter of 2024. President Bola Tinubu gave an estimate of 49.7 trillion naira 2025 appropriation bill to the joint session of the Senate and the House of Representatives, attributing the successes recorded so far in economic reforms to the patience, resilience and tolerance of Nigerians in supporting the process. The budget projects inflation will decline from the current rate of 34.6% to 15% next year, while the exchange rate will improve from approximately 1,700 naira per US dollar to 1,500 naira, and a base crude oil production assumption of 2.06 million barrels per day. President Tinubu said the priority areas for the 2025 budget allocations are defense and security, 4.91 trillion naira, infrastructure, 4.06 trillion naira. We have health, which is 2.48 trillion naira, and education, 3.52 trillion naira. To help understand more on the 2025 budget and a significant on healthcare development, we have the founder, Love for Health Organization and policy analyst, Dr. Yusuf Harun, joining me via Zoom from Lagos. Thank you for joining us on the program.
Thank you very much. It's a pleasure.
Right, we've seen a whole lot of reactions following the presentation of this budget. But let's begin with your assessment of the parameters upon which the 2025 budget is hinged, looking at the exchange rate of 1,500 naira, 2.06 million barrels per day, and also the oil benchmark.
To understand where we currently are, we have to look at where we are coming from. So we got our independence in 1999 to 2024. The budget in 1999, when President Olusegun Obasanjo, the former president, presented it for the 2000 budget, it was 677 billion naira. And then the exchange rate, foreign exchange, was 85 naira to $1. Flashback to today, and the president, currently President Bola Ahmed Tinubu, presented the budget on Wednesday to the National Assembly of 49.7 trillion naira, and the exchange rate is ranging between 1,500 naira to 1,700 naira, depending on the parallel market and looking at where you are exchanging it. Now, what is most concerning to me is the health sector, which you talked about, 2.4 trillion naira on health. It looks like a lot, but if we look at the exchange rate of 1,500 naira to $1 or 1,500 naira to $1. And we also see that this is about 4.8 to 5% of the whole budget on health. Compare this to the United States of America, where the percentage of budget on health is 17.6%. So we see that it's staggeringly different and it is too low compared to what we are expected to. As a medical doctor, I suggest that more funds should be put into the health sector. I commend the president for security. For example, if you travel from Kaduna to Abuja now, it is safe compared to 2 years ago when there was banditry on the train and when insecurity was at its peak. I commend him also in terms of electricity in some parts of Nigeria. We see that the electricity is improving, especially those who are in the band A. I also commend the president in terms of education for him to give out student loans and to also give out different kinds of support to the farmers. But in terms of health, I believe the president and the Ministry of Health can do better. And I also implore the Ministry of Finance to look into the health sector because many Nigerians can't afford primary health care. And this is going to affect their lives and also their daily living. So I suggest that we have a budget estimation of about 10 to 15% on health care. And we should focus more on primary health care, the PHC. We should focus more on the women and children. We should focus on communicable diseases. I was here few days ago to talk about pulmonary tuberculosis and how Nigeria is the highest burden of pulmonary TB in Africa and one of the leading countries in the world. So the government should invest more or should even fund more into this kind of treatment to eradicate tuberculosis completely from Nigeria. I give the government kudos for eliminating polio. I also give the government kudos for what they have done in other sectors. But as a medical practitioner, I believe that the government can do better in terms of health. Not only the government, even private practice like NGOs, even the state government, we should all work together, collaborate to make sure that the government is able to provide sustainable health care to everybody at the basic level, at primary level in particular.
Well, some will say the 10 to 15% you are suggesting is quite ambitious. This 2025 budget itself is ambitious in itself, looking at some of the figures here. And as much as we would like to, compare ourselves to countries like the United States that you mentioned, it's also important for us to understand our current realities. And as the medical doctors, you've mentioned, major issues affecting the healthcare population. And there's been relatively very opinion about the health allocation over the years. Looking at our increasing health needs, would you say what we have on ground is enough to kickstart the major issues or to address them as we can?
Firstly, if we look at our population in Nigeria, we are estimated to between 229 to 290 million people, depending on the statistics you look at. So if we look at this large population we are one of the most populous countries in the world. We are definitely the most populous country in Africa, and we are certainly the most populous black nation in the world. So looking at this estimation of 10 to 15% is not being overambitious. What we have to consider we should look into consideration is that when we have an estimate of 10 to 15%, even if we don't meet up to it, if we meet up 8 to 9%, we will do relatively better than now, in which we are running between 4 to 5%. We should also consider that this is an estimation. When the actual budget comes as appropriation bill and when funding really comes, we may notice that even the actual funding for the health sector might not even be up to 2%. This is something which we have seen go on. Now, let's look at the budget last year, 2020, the budget of 2024, when we're in 2023. It was about 27.7 trillion naira. What was the budget for health? Also about 4 to 5%. Look at the budget in 2022, when 2023 budget was. It's also that flashback to 1999, when former President Obasanjo also did the budget. Health sector has always had a trend of taking a low share of the national budget. And that is why we are having a high burden of disease, a high rate of infection. HIV is still high in Nigeria. Tuberculosis, cholera, dysentery. So these are part of the factors we have to put into consideration. Majority of Nigerians are suffering from one kind of disease or the other. I've talked about hypertension and diabetes. These are silent killers, together with other conditions like ovarian cancer that affects women, and all other conditions, cervical cancer, breast cancer, prostate cancer in men. So we need higher budgets into the health sector so that we can improve in our diagnosis in Nigeria. We can also improve in medical research. Nigeria is lagging behind in terms of medical funding and medical research. Research or treatment or funding, or even this budget we are talking about, shouldn't only be focused on buying anti-malaria drugs or building hospitals. We should have a particular fund which is diverted into research, medical institutes. For example, we have the FIRO, we have the Federal Institute of Research, we have the Virology Research Institute, we have the National Disease Control Sector. All these kind of sectors should have a high budget so that they can be able to diagnose disease. They can also know more or better cure or better treatment for some of these current diseases. Look at the example, look at the COVID-19 that happened in 2019 and spanned to 2023. Nigeria was lagging behind in discovering these vaccines. Assuming we have a high budget into medical research, Nigeria should be one of the leading countries, even in Africa, to discover the vaccines or discover a means of prevention or of this kind of disease. We shouldn't wait for another 10 to 20 years when another pandemic is going to spread around the world, and we'll be looking for the West to provide a treatment for us. We should also start investing into our own treatment. We have many forms of treatment here. We just need to regulate it. For example,
all right, Dr. Aaron.
We have this traditional care.
We still have a lot to discuss on the federal government's allocation on budgets for 2025, but I'm just going to put you on hold for a moment. Let's quickly go on a quick break. We'll be right back. Stay with us. Thank you for staying with us on the program Beyond 100 Days. And we're still talking about the 2025 budget, which was presented this week by the President, Bola Tinubu. And there's been a whole lot of, reactions, trailing the allocations for major sectors like health, infrastructure, and also security. We still have with us the founder, Love for Health Organization, and also a policy analyst, Dr. Yusuf Harun. Thank you for staying with us on the program. I would like to take you up on the primary health sector, which is another area that some will say has, faced a level of decline over the years. But looking at our debt servicing prospects and the risk of debt servicing for 2025, what are the hopes for the primary healthcare sector?
I'm highly optimistic in terms of the primary healthcare because I also practiced in primary healthcare during my NYSC over 10 years ago. And I noticed that majority of the population still attend the primary healthcare. For example, immunization or vaccination. Many women still go there to take their basic vaccines from BCG at birth to even the ones they take in 9 months and beyond, 1 year. Yellow fever vaccines, measles vaccines, and things like that. So the primary healthcare sector still plays major role in our society. And this is the best way in which we can reach out to the majority of the people in the society. I also suggest that there should be a special budget for the primary health sector. This shouldn't only be from the federal government, as everybody have this misconception or this misnomer that the federal government should do everything for all Nigerians. That's not correct. I believe that the state government also has a major role to play in the primary health care. I also believe that the local government chairman, local government also have major role to play in the primary health care, because the primary health care is deep-rooted into the local government, into the wards, into the homes where people are close to. So I suggest strongly that budgets from the state government and the local government also should have a higher percentage on healthcare so that everybody can have a feel of primary healthcare or primary healthcare services. We should also remember that anytime we fall with a disease, for example, somebody had a long-standing hypertension which develops into stroke, for example, and the person is rushed to the hospital with cerebrovascular accident from complications of long-standing hypertension or hypertensive heart disease, we should know that that means there is a failure of prevention of a disease from the primary health care. So I'm highly optimistic that we can still revive the primary health care. We can employ more medical practitioners there. We can employ more nurses, paramedics. We can also fund the primary health care looking more attractive for people to attend. Everybody wants to rush to the tertiary hospital. For example, in Lagos State, everybody wants to go to Lagos State University Teaching Hospital for care and treatment. This shouldn't be the first priority for every individual. Everybody should have a primary health care close to his or her house, in which if they have any complaint, they can go directly to the primary health care. I also suggest, based on Law for Healthcare, which we are doing, is to provide online care even for people, virtual care, telemedicine. So this is another avenue which I want the government to look into, and they should fund. There's something called telemedicine or online care, where people from the comfort of their home, they can even chat with a medical practitioner. They can chat with a doctor. They can talk with a nurse. They can make their complaints. And if they even need some basic medications, there could be an online prescription. This is what I saw in the hospitals in America, where I was. And I see that, yes, that even from my home, I'm being prescribed medications, or I can even receive drugs, and they are mailed to my address, and the prescription and the dosage in which I can use it. So I believe strongly that primary health care is something which is still sustainable, and it is the bedrock of healthcare all over the world, especially in Nigeria and Africa in general. So this is something which we should consider strongly. I also wrote a research about telemedicine, and I wrote one particular book, and I said the title is From Prevention, Curative to Prevention. So how we can cure things, how we can prevent things. It was something which I released at Franklin University in the US. It's something which I also want Nigerian system, the healthcare system, to follow this. Curative to preventive. How we can cure and how we can prevent.
All right. 2.48 trillion naira on health, some will say, is actually a whooping sum to, jumpstart some of the changes that you have mentioned that we need in the health sector today. But let's talk about vaccination at this time where, the country is still managing some outbreaks. And there are still also, news about another strain of the COVID-19. Talk to us about the prospects of this budget for 2025 and how possible it is for the government to be able to, manage the outbreaks, provide vaccines as soon as possible in case of a possible outbreak of another strain of COVID-19.
Now, 2.4 trillion naira is it's a lot. But when we look at it in dollars, it's about $3.1 billion, firstly. Secondly, when we look at our population, Nigeria's population being about 229 million people. So we look at it again. If we are to invest this fund or this budget only in the vaccines you talked about now, the COVID-19, a new strain that is out, we know how much we are going to spend. For example, if Pfizer is going to supply us with COVID vaccines, except they are going to give us at a discounted rate, or World Health Organization is going to support us, or we get some big bodies like United Nations, USAID, UNICEF to also fund this program. We know that vaccines are things that cost millions, if not billions of dollars for it to go around the whole population of 229 million people. So that alone is going to gulp a lot of funds. And that is why I insist that that particular amount on budget is relatively low compared to Nigeria's population. Also, I talked about tuberculosis a few days ago. Look at the vaccine for TB, the BCG. Look at how much the government will spend. Now, the government also rolled out about 13 to 20 diagnostic devices or methods in detecting pulmonary TB. We know how much this is also going to cost. Logistics, health, treatment, also the staffs in which they are going to pay for this. And I will use this opportunity to say this. Why we need to fund healthcare is to prevent young medical practitioners from brain drain, that is migrating to other countries where they could earn more than what their contemporaries will be earning here in Nigeria. So this is part of what the government has to put into consideration when they are making a budget on health. They have to look at payment of the lecturers, of the professors. Many professors now, or many medical consultants, are looking at traveling to the United States, traveling to UK, Canada, even Saudi Arabia or other parts of the world, because the salary of medical practitioners here is just barely $500. And a cleaner in the United States can even earn $2,000, $3,000 a month. While a medical consultant here...
Dr. Arun, very quickly, because of our time, implementation is another issue. Let's talk about how the government will ensure, discipline, implementation and transparency, and possible collaboration with stakeholders, and possibly privatization in the health sector to achieve the budget objectives ahead for 2025.
I am in strong support of privatization because if you look at things that belong to the government, it's like nobody's concern. But when you give it to a private body, it tends to what? It tends to develop. A good example is the oil sector, if I must digress. Look at the oil sector, look at NNPC, and look at Dangote refinery. You can see when an individual privately built a refinery, it started working even faster than the other refineries in Nigeria, which have been laying dormant for years and decades. So I strongly support the private sector, which you talked about. And I also recommend that the government should encourage private sectors to open the windows to private practice to come in and invest in healthcare so that we can have a first-class medical system which will operate well in Nigeria. I'm highly optimistic in this, and I believe this is possible just with collaboration with private bodies, both international and national. I believe this is something which is feasible, it's possible, and it is something which is achievable. But I must commend the federal government. I must commend the Federal Ministry of Health, who they also follow me, and I appreciate that on social media. And I'm happy that they listen to what Nigerians say and what Nigerians talk about. One thing I must give to this government is that this government is listening. For example, look at the tax reform bill, because many people made different feedbacks about it. They put it on pause for a while to have town hall meetings. Also, this budget, I believe that the government is listening, and they will also sit down and look at how they can fund the healthcare sector better than how it is. It's not going to be wrong or bad if Nigerians are getting almost free healthcare, like the government is doing currently in transportation. I believe that within this season, there is free mass transit, especially for the trains within this period. So I believe there should also be free or almost free health care for the poor Nigerians who cannot afford basic care and treatment.
Thank you very much, Dr. Harun, for that. The budget has passed the second reading at both houses. But that's our time on the program today. Founder Law for Health Organization and policy analyst, Dr. Yusuf Harun. Thank you for joining us on the program.
Thank you very much.
That's it on the program today. You can watch a repeat at midnight at 6 a.m. tomorrow. I'm Olamide Adeyemi.